Hi, Dr. Mark Agresti. I'm in my office in Palm Beach, and I want to talk to everyone about benzodiazepines and why they're not good for long-term use because they cause permanent damage. What are benzodiazepines? They're very commonly used drugs. What are their names? The names I'm going to give you represent about 95% of all scripts. Xanax, alprazolam, Ativan, lorazepam, Valium, diazepam, Klonopin, clonazepam, and Librium, chlorodiazepoxide. Another one would be midazolam, which is Versed. What are these drugs used for? Common reason people take them, they calm you down. So they're used for generalized anxiety disorder, panic disorder, anxiety-related disorders, maybe post-traumatic stress. They can be used for sleep. Drugs like triazolam and florazepam and temazepam can be used for sleep. They can be used for detoxing people. Librium is used to detox people off of alcohol to prevent seizures. And they can be used as hypnotics to sedate people and cause retrograde amnesia so you don't remember having a procedure, like Versed or Remiversed or Remimazolam, which is used procedurally when you're getting an operation. They give you a little of this, you're out, you don't remember what's happening, you're fine. Here's another complicating factor. Some of these drugs, like diazepam and Klonopin, can last for weeks in your system. Diazepam can last 2 to 3 weeks after one pill. Klonopin, maybe a week, 10 days. Ativan, a week. So the effects of these compounds last a long time, meaning just taking them for a few days means your system has them in the system for a long period of time, having its detrimental effects. Now, why is it so dangerous having these drugs in your body for a long period of time? Some general information. These drugs affect GABA. GABA is short for gamma aminobutyric acid. GABA. GABA is one of the most, if not the most common drug in the human central nervous system. It is inhibitory. It stops nerves from firing. That's why it calms you down. It acts in opposition to one of the most stimulating neurotransmitters, glutamate, glutamic acid. The yin and the yang between these two drugs. Too much GABA, you don't move. You just sit there, apathetic. Your system is totally inhibited. Too much GABA, too much glutamate, you're irritated, agitated. The feeling you get when you're coming off alcohol, the feeling you're getting when you're withdrawing from benzodiazepines like Klonopin, Ativan, Xanax, malaise, restlessness, tremor, seizure. Too much glutamate is no good. How do these drugs work? This is all going to get to the point, and everything I'm saying will explain why these drugs are so dangerous, so bear with me. The cell acts as a membrane with negative charges on the outside of chloride and positive charges on the inside, sodium. When you have a depolarized cell membrane, negative on one side, positive on the inside, it causes a chain reaction and sends an action potential, meaning a message down the neural pathway. That's how nerves communicate with one another. GABA causes the chloride ion to go into the cell, hyperpolarizing, meaning that messaging system stops. That's where you get the inhibitory effects from GABA. What is the GABA receptor? We're talking about the GABA receptor, and that's where all these drugs work, is a bunch of 5 globules of protein, and it creates a tunnel that opens and closes. So when we have Xanax, Ativan, Klonopin It opens up the channel, letting chloride go in. And what that does, it hyperpolarizes the cell membrane, meaning no messages gets transferred. Great. That's great if you're anxious, panic attacks, you're trying to slow the system down. Here's the problem. When we do that, these drugs interfere with the transmission of neural messaging. And they do that by hyperpolarizing the cell membrane. And they do that by making GABA work very efficiently at that membrane, that cell receptor site on the membrane. Yeah, that sounds good. But the body has a response to that. And there's something called homeostasis. Whatever you do to the human body, it always reverts back to a set point that it likes. So whenever you change something in the human body, it reacts by going back to where it wants to be. If you increase GABA, it does everything in its power to decrease GABA or the effects of GABA. And in this case, what does it do? First of all, these drugs act by making GABA work more efficiently. They don't actually work on the exact GABA receptor. They just make GABA work more efficiently. They make it bind better. They make it act more efficiently on the receptor. And when it reacts, they make its reactivity greater. That sounds great. But you know what the body does? It says, fine, you're going to mess with me. I'm going to make less GABA receptors. I am going to make the GABA receptor less effective because there's too much GABA around. I'm going to stop producing as much GABA. And when you bind to my GABA receptor, I am going to not react as robustly. That's a serious problem because everything's fine when you're giving artificially elevated or inducing the GABA to work artificially better. But what happens when you stop it? It doesn't return to normal. You've now anatomically changed the brain at the cellular level. So you say, well, can't the brain heal itself? Not always. If you're on these drugs long enough, and if you're on a high enough dose, it doesn't come back. You say, well, when I took opiates like oxycodone, hydrocodone, morphine, Demerol, I stopped them and I bounced back right away. But that system's different. This system doesn't adapt. The GABA system does not adapt. And you know what should be going off in your head right now? Wow, you've permanently damaged your brain. And GABA is one of the most ubiquitous, most prevalent neurotransmitters in the brain. GABA and glutamate are the yin and the yang of the brain. Inhibition, stimulation of the central nervous system. And when you take away the inhibition, you're overstimulating it. And what do you get? Malaise. You don't feel right. Anxiety, restlessness, can't sleep, tremor, pacing, can't sit still, sense of uneasiness, sense of impending doom. Not good. That's what people get who've been on long-term benzodiazepines and then they're cut off from their benzodiazepines. I've seen it. I have a lecture. You could go through my videos all about benzodiazepines and what they do, how long they act, and how they work. This is a warning sign. You cannot stay on these drugs long term. They seem innocent. You may not feel anything. You may not feel anything till you try and stop. They do anatomical, permanent damage at the cellular level. That's why Xanax, Ativan, and Klonopin cannot be used long term because they permanently throw off the body's balance between GABA and glutamate. And what they throw off is the inhibitory compound GABA. And without it, the system is out of whack and you will feel horrible. And that's what happens when people use these drugs long term and then try and stop. There's some new benzodiazepines on the market, just for completeness' sake. There's a new lorazepam called Lorev XR, which is a new form of Ativan that lasts longer. And there's a new form of midazolam. It's called remimazolam, which is a little different. All it does is act quicker. Its onset is quicker, and it gets out of your system quicker. So when you're going to get any kind of surgery or a procedure outpatient, it's in and out, and they can get you up and out quicker. So there's more control over the drug. That's the only nuances in the world of benzodiazepines. These drugs have been around since 1965. I happened to grow up next to the factory in Nutley, New Jersey of Hoffman LaRoche that first made diazepam. It was a little city, to tell you the truth. That's how much diazepam was used. This one factory produced virtually all the diazepam Valium in the entire country. That's just a little history. I just happened to grow up next to the biggest diazepine factory in the world. Okay, thank you. Dr. Mark Agresti signing out. More information, you go to my website, dragresti.com.